Have you ever thought about the diseases you could contract by kissing or sharing items with a complete stranger, friends or loved ones, whom you do not know about their everyday whereabouts? You might be thinking about the germs that can potentially give you a cold or a flu that your body will heal from over time. But did you know that there are incurable diseases that stick with you for a lifetime, that you can get through saliva by kissing, oral sexual activity, or sharing items contaminated with another person's saliva? I'll tell you exactly why these thoughts came to my mind and triggered me. Let's go back to my trip from Asia. As I was traveling the streets of Bangkok and Phuket in Thailand, and Saigon, aka Ho Chi Minh in Vietnam, I noticed a large scale of prostitution and thought to myself, wow, the amount of diseases like chlamydia, gonorrhea, STDs, HIV shared amongst all these women and men is such a frightening experience. Risking one night of fun for an organ-damaging disease, for a lifetime of debilitating symptoms, subconsciously hurts my mind, my mental, physical, and reproductive health. Then I had another horrific thought of this one time when I was taking care of a patient with throat cancer in the previous hospital that I worked for. The tumor was the size of an orange in her throat. She made me think, how did she develop that? That deadly and painful tumor? And that must be one of the worst types of cancers to have for 3 reasons that I had to witness firsthand. Cancer in her throat had gone so bad that her tongue was protruding outside of her mouth, making it impossible for her to close her mouth, which forced her to mouth breathe. What made it worse was that she was having extreme difficulty breathing because she developed a cold and an infection that gave her a stuffy nose. So she was gasping for air with the very small and narrow airway that she had available to her. Because the tumor was so large, like an orange, it had restricted the airway that she had available to mouth breathe. Second, the tumor in the throat was so large, it had been untreatable with radiation. It was spreading and growing, so the orange was getting larger and larger over time. And since the tumor was so large, it became impossible for doctors to do life-saving treatments, like intubation or assisted airway through the neck, in the event that she needed something to help her breathe, in the event that she just couldn't breathe on her own anymore, which meant that she was technically drowning from a lack of oxygen. I'm sure you've been sick with a congestion or stuffy nose, and then in the evening you try to sleep at night, but you felt like you could hardly breathe when you were trying to sleep. Wasn't that feeling so uncomfortable? Third and lastly, she had mouth sores all over her mouth that were incredibly painful, and it might have been from the stress her body was experiencing. The sores may have been caused by the activation of viruses that lay dormant in her body, which I will later explain in this video. And because she was unable to close her mouth, she developed cracked lesions all through her lips, her tongue, and inside of her gums, which caused her to have a constant burning pain in her mouth. And for this reason, I wanted to discuss with you 3 incurable diseases you could develop through the saliva of someone else. Yes, that's right. You can contract incurable diseases by sharing saliva, by kissing someone, participating in oral sexual activity, or just sharing any type of items with fragments of saliva from somebody else. Sit back and make sure you share this valuable information with your friends, your family, your children who are growing up and getting out there into the social world, who are able to get close and personal with another human being that carries diseases. Because the purpose of my discussion is to make you extra cautious. So cautious that the next time you decide to kiss a stranger who you've recently met on a date, or share a cup with a random stranger, or even a close family member or friend whom you don't know their daily, everyday whereabouts, but you know what I mean. Getting too close and personal too soon without really knowing a person's state of well-being, because that stranger, friend, or loved one can give you a disease that could potentially harm you for a lifetime. So the question to think about while you're listening to this video is, do you think we should make testing for incurable diseases a norm when we decide to share our bodily secretions with another person? In medical terms, this is called herd immunity, when you protect the healthy individual from those who are sick by providing a barrier, similar to like a vaccine. In this case, it would be prevention and protection by laboratory tests, blood tests. It sounds like a tedious process, but it may prevent you from contracting an incurable disease that can be passed down to you from saliva and secretions. So the first incurable disease is cytomegalovirus. It is a common virus, and it is a member of the herpes family. Similar to other herpes virus, once you're infected with cytomegalovirus, it will live inside of you for a lifetime. It lives in the blood stem cells that make immune cells in your body. And this virus gets reactivated when your immune system is low. And even if a woman becomes pregnant, she can reactivate this virus, and this virus can be passed down to her child. Then, months or years down the line, the child can become affected such that they can develop hearing loss and developmental delays. A little bit of statistics. Approximately 59% of the population older than 6 years old have been exposed to the cytomegalovirus. Usually the infection is not symptomatic, meaning you will not show any signs and symptoms of the disease when you're initially infected. And the most common type of cytomegalovirus shared through saliva is what you probably have heard before, the kissing disease, aka mononucleosis. And those who are healthy infected with mononucleosis can have symptoms like fever, fatigue, sore throat, rash, and muscle aches. And then those who don't have a strong immune system, eventually the cytomegalovirus can affect organs such as the liver, lungs, and colon. There have been several medications or antivirals that have been used for cytomegalovirus. However, these medications only help with the symptoms that this virus can give you. Because then again, this disease is incurable. The prognosis for cytomegalovirus infection is usually good. A person can recover fairly soon if they are healthy, but it's been known that the fatigue can last several months. And then when your immune system one day becomes low because you're sick or you're just aging, or you have low vitamin D levels because vitamin D levels are tied to strong immune system, this virus can be reactivated and it can make you incredibly ill. The second disease that you can contract through saliva is herpes simplex virus type 1. Research has shown that herpes simplex type 1 affects 1/3 of the population, which means 1 out of every 3 people that you meet has this virus. And usually when you become infected with the virus, you do become symptomatic. So type 1 herpes simplex virus is usually spread through saliva, while herpes simplex virus type 2 is spread through sexual contact and usually affects the genital areas. So this type 1 virus can affect the mucus lining inside of your mouth, and once it makes its way to the nerve cells inside of the mouth, that's where these virus cells stay dormant or they live. This virus will hide there until it is reactivated at a later time. Symptoms associated with type 1 is what we know as cold sores or fever blisters. Prior to getting these cold sores or fever blisters, people will often complain of feeling more tired than usual, having loss of appetite, fevers, tender lymph nodes in the neck area, pain where the cold sore or fever blister is developing in the mouth, some tenderness around the site and burning sensation, and a little bit of tingling prior to the full development of the cold sore. Usually it takes about 2 to 6 weeks for these cold sores to crust over and to completely vanish. In order to determine if you are infected with herpes type 1 virus, you'll need to ask your doctor to get a blood sample, and they will be able to detect if you have antibodies against this virus, which means that your body had been fighting off this infection for a lifetime. The last incurable disease that can be transferred through saliva is oral human papillomavirus. Usually people who have oral human papillomavirus, they don't have symptoms. Therefore, these people can spread the virus without even knowing it. And the scary part about oral HPV is that it can turn into oropharyngeal cancer, similar to the woman who had the neck tumor that I had previously discussed. So what is oral HPV? It is the subtype of human papillomavirus, and it is the most common sexually transmitted disease. There's over 100 strains, and 40 of them affect the mouth, throat, and genitals. Out of the 40 strains, 9 of them can turn into cancer. And the strain that causes oropharyngeal cancer, or tumor of the neck and the throat, is HPV-16. Research has shown that HPV-16 occurs in about 1% of the population. However, the 1% that get HPV-16, 2/3 of those develop oropharyngeal cancer or throat cancer. However, getting HPV alone does not cause cancer, and these triggers include smoking, folate deficiency, UV light exposure, low immunity, and pregnancy. So how common is HPV in the mouth? A recent study showed that 7% of Americans between the ages of 14 and 69 are infected with oral HPV, and the numbers are growing. Usually, more men have oral HPV than women. And like I said, symptoms of oral HPV usually don't show. But when they do, sores and warts can develop on the lips, in the mouth, or inside of the throat. So if you have a new sore or a wart in your mouth, the best way to determine if it is HPV is to go to the doctor to get a sample of that lesion and for them to send it to get it tested. So now that I've gone over the 3 ways you can develop an incurable disease by sharing saliva with someone else, do you think that the right thing to do is to get ourselves tested before sharing items with others or becoming intimate with others? We should know ourselves before we put others at risk for a lifetime incurable disease. And if your potential mate or your friend refuses to get tested, well, you have the risk of risking your own health for a lifetime because you don't know what they have, or you can just boot that person to the side. for their personality trait of inconsideration and willingness to make you suffer at some point in your life from these 3 incurable diseases. Well, I hope you enjoyed my presentation. Stay safe and take care, friends of YouTube. Bye!